Greetings and welcome to PHS, where we are excited to have you on our team.
Over the duration of this presentation, you will learn general information about the group benefits PHS offers to full-time employees, including health, dental, vision, voluntary accident policy, flex spending, disability, life, and 401k. This benefit information applies to the plan year, which runs January 1st through December 31st. The election period is 30 days from the date of hire. If benefits are not elected within the 30-day election period, benefits will be assumed waived until the next open enrollment period in January or due to a qualifying life event. The effective date of your elected benefits will be effective the first of the month following the date of hire.
Great, now let's get started. First, we'll discuss health insurance. PHS offers 3 network options through Blue Cross Blue Shield of Minnesota, the Blueprint featuring Allina Health Network, Blue Performance Regional Network, and the Aware Network. The main difference between the 3 networks is the size of the network, meaning a small network is going to have less provider options than a larger one. Blueprint, also referred to as the Allina Health Network, is the smallest, cheapest, and most popular network among our employees. Members of this network must use providers and facilities within the Allina Health Network. Blue Performance Regional Network is a tiered network larger than the Blueprint network with many additional providers and facilities to choose from. The Aware Network is an open access network. This network provides members with the most choices in providers and facilities. Regardless of the network, all members will have access to the Blue Card PPO network when outside of Minnesota and Blue Card Worldwide network when outside the United States. A primary clinic choice is not required upon enrollment. Members should choose an in-network clinic or physician at the time of need. Here are a few examples of clinics within the Blue Performance Regional Network. The Blue Performance Regional Network also consists of 2 tiers. It is important to remember Tier 1 providers and facilities will cost less than Tier 2 providers and facilities. Refer to the materials in the orientation binder. Look on the back page of the Blue Performance Regional Flyer to see a sample of clinics and hospitals that are in-network. Here is what the Blue Performance Flyer looks like. On the back, it has a sample listing of providers. Be sure to look up your providers online for the most up-to-date information. The in-network deductible and out-of-pocket maximum is $4,500 for an individual and $9,000 for a family, with the exception of the Blue Performance Regional's Tier 2 network providers. Once a spouse or child is added to a member's coverage, it is considered family coverage. There is no coinsurance. Members are billed for 100% of the services, less the Blue Cross negotiated discount. Once the deductible is met, all services are covered 100% with the exception of Tier 2 providers. In-network lifetime maximum is unlimited. Preventative services are covered at 100%. Examples of preventative service would be annual physical, annual eye exam, certain vaccinations, cancer screenings, and child well care. Emergency, urgent care, and all other care is covered 100% after the deductible has been met.
Our plans do not have a copay for office visits. Retail clinic visits to, say, Target or CVS MinuteClinic are covered at 100%. Doctor on Demand is also covered at 100%. An HRA savings option accompanies a member's account regardless of network choice. Maximum allowed HRA amounts are $2,250 for an individual and $4,500 for a family. The amount of HRA dollars a member receives is determined by the member's effective date and prorated. More information on the HRA will follow soon. If health insurance is elected, the premium is deducted from your paycheck. These are the amounts that will be deducted from members' paychecks depending on the network and coverage selected. Notice the low cost of the Blueprint network when compared to the Aware network. This slide shows out-of-network costs. In-network or out-of-network could affect how much you pay for your healthcare services. If the doctor, hospital, or facility you visit is part of your insurance company's network, you'll get your healthcare at lower prices. But if you go outside of your network for healthcare, it becomes a lot more expensive. Notice how the deductible increases, coinsurance now applies, and the out-of-pocket max increases as well. Stay in-network whenever possible. It will cost much less. This slide focuses on prescription drug benefits for the Blueprint Allina network. Prescriptions filled at an Allina pharmacy have the lowest cost.
In fact, members pay nothing if a script is filled for diabetes, high blood pressure, cholesterol lowering, or smoking cessation drugs. Scripts filled at a network pharmacy like Target, Cub, or Walgreens will cost a bit more. There is no coverage for out-of-network pharmacies.
These are the prescription drug copays for the Blue Performance Regional and Aware Network. The copays are the same between the two networks. For a 30-day supply, the copay is $16 for generic, $60 for brand, and $100 for non-preferred. To find a doctor or clinic, visit www.bluecrossmnonline.com and click on Find a Doctor.
Then enter your location and provider name or specialty and click Search. Next, select your network from the drop-down menu on the left. Review the search results and click Create PDF if you wish to save for later reference. You can also search the Allina Health Network at www.allinahealth.org. Many users find this site easier to navigate. Next, we will review some of the services and benefits that Blue Cross Blue Shield members have access to. Members are encouraged to register on the Blue Cross MN website using the information on their member ID card. Once registered on the secured site, members will have access to their account with many useful features, such as claim history, remaining deductible amount, provider cost comparisons, list of covered drugs, refill mail order prescriptions, HRA and FSA account info, health and wellness resources, 24-hour nurse line, employee assistance program, and fitness center discount information. As previously mentioned, Blue Cross Blue Shield members are covered 100% when they use Doctor on Demand. No appointments are necessary, no need to leave the house or office. It's available 24/7. Qualified doctors can diagnose, give medical advice, treatment recommendations, and in some cases prescribe medication. The box on the right provides examples of the most commonly treated conditions. The use of retail clinics is also covered 100% in all networks. Use this option for minor illnesses or injuries. It's faster, cheaper, and more convenient. Clinics are commonly located in grocery stores, pharmacies, and discount stores. Transparency Solution provides members the opportunity to view cost estimates for treatments, physician qualifications, physician reviews, and hospital quality information. This concludes the general health insurance information. Now we will focus on the health reimbursement arrangement, which is a separate component that reimburses members for deductible costs. A health reimbursement arrangement, or HRA, is a virtual account funded by the employer used to reimburse members up to 50% of each claim up to the deductible amount. An HRA account is automatically set up with Select Account for each Blue Cross Blue Shield member. Select Account will not reimburse members any money until a member receives medical services through Blue Cross Blue Shield. The amount funded into a member's account is determined by the insurance effective date and is prorated at 1/12 of maximum amount for each month insurance is effective. HRA reimbursement is automatic, no need to submit a request for reimbursement. Direct deposit is available. Members may access their accounts at www.selectaccount.com. Unused HRA dollars do not roll over into the next plan year. The HRA is not portable. In the event health benefits are terminated, the HRA will terminate as well unless COBRA is elected. Here is an illustration to help explain. The deductible is $4,500 for single coverage. If a member's insurance is effective January 1st, they will receive up to the maximum HRA amount of $2,250, which is 50% of the deductible. The most this member will pay is up to the remaining $2,250, which is the other 50% of the deductible. Here's an example of a member with single coverage coming on mid-year. They will receive $187.50 per month through December. Example: if insurance is effective July 1st, the HRA funding calculation is $187.50 times 6 months, which equals $1,125. The HRA will reimburse up to $1,125 of the $4,500 deductible. The most this member will pay is the remaining deductible amount of $3,375. Here's an example of a member with family coverage. They will receive $375 per month for January through December. $375 times 12 months equals $4,500 for that member to use toward their $9,000 family deductible. If insurance is effective July 1st, the HRA funding calculation is $375 per month times 6 months, which equals $2,250. The HRA will reimburse up to $2,250 of the $9,000 family deductible. Here's an illustration of the HRA process. First, the member receives medical service. Next, Blue Cross Blue Shield processes the claim and a bill is generated saying the member owes $100. Then, Blue Cross Blue Shield transfers the claim to Select Account for HRA reimbursement. Select Account reimburses the member's 50% of the amount due, assuming $50 is available in the member's account. Finally, after reimbursement, the member is responsible to pay 100% of the amount due to whomever billed them. HRA members with secondary insurance, such as Medicare, should turn off the crossover feature and submit claims manually for HRA reimbursement. Turn crossover off by logging into your account at www.selectaccount.com.
Now we move on to dental and vision insurance.
PHS offers one dental plan through Delta Dental of Minnesota. With our Delta Dental plan, you have access to both Delta Dental's PPO and Premier network. The most savings will be realized by using a Delta Dental PPO network dentist. If dental insurance is elected, members using in-network providers will receive a maximum benefit of $2,000 per member per year with no deductible. If a member decides to visit a dentist out of network, the maximum benefit remains at $2,000 per member per year, but members will pay more for services and will pay deductibles of $25 per person, $75 for family coverage. Here's a brief summary of benefits. Preventative is covered 100%, basic services are covered 80%, major services covered 50%, and orthodontic for dependents under age 19 covered 50%. If dental insurance is elected, a premium is deducted from your paycheck. These are the amounts that will be deducted from members' paychecks depending on coverage elected. To find a dentist, go to www.deltadentalmn.org, then click on the Find Dentist button in the top right corner of the page. On the Find Dentist page, you will select the PPO and Premier networks only. You can search for a dentist using an address, city and state, or zip code. You may also search by dentist name and specialty by clicking on the Additional Search Options button. A list of in-network providers will appear to assist you in finding a dentist within the area entered. It will also display if the dentist is in the PPO or Premier networks. You can also download this list as a PDF for reference later. Keep in mind the deepest discounts will be obtained by using a Delta PPO dentist.
PHS offers all employees the opportunity to purchase a voluntary accident policy through Cigna. This policy provides a fixed benefit based on a broad range of medical treatment or care resulting from a covered accident. Here is a brief overview of some of the benefits under our voluntary accident policy, including a few examples of the preventative benefits the policy provides for things such as flu shots or your annual wellness exam. Please refer to plan information on UltiPro for a more detailed plan overview. PHS pays for the cost of a vision materials plan through iMed. This plan helps cover the costs of your frames, lenses, and contacts. If you are on our health plan, Blue Cross provides an annual in-network eye exam at no cost. To search providers, first go to imedvisioncare.com and click on Find a Provider. Next, input your zip code and choose the Insight Network and click Get Results. On the results page, you will be able to view and filter provider results and map results as well for reference. Here's a brief overview of the coverage on our Vision Materials Only plan. Please refer to plan information on UltiPro for a more detailed plan overview and the additional discounts provided on things such as non-prescription sunglasses, LASIK, and hearing aids.
Next, we'll discuss the Flexible Spending Account.
A flexible spending account is funded by the employee pre-tax through payroll deductions. The amount allocated to the FSA is used to reimburse members for the purchase of eligible medical expenses and qualified dependent care costs. Eligible expenses must be incurred during the plan year, but not prior to members' effective date, and no later than December 31st. Estimate your annual election wisely. You will only be allowed to roll up to $500 into the next year.
Eligible FSA medical expenses are as follows: medical deductible and coinsurance costs, dental and vision costs, pharmacy copays. For a complete list, visit www.selectaccount.com or the IRS website. If elected, FSA participants will receive a welcome letter and PIN to register and access account information at www.selectaccount.com. From there, you'll be able to view claim history, check account balances, sign up for direct deposit, and review lists of eligible expenses.
Blue Cross Blue Shield members who are also FSA participants will have an added convenience of the crossover. The crossover eliminates the need to submit a claim for unreimbursed healthcare expenses as they will be processed automatically with your FSA and HRA. Ability to view crossover details via bluecrossmnonline.com.
It's extremely important to understand the automatic crossover process if you're considering participating in the FSA. This slide applies to Blue Cross Blue Shield members who also participate in the FSA. A member receives a medical bill for $100. The HRA reimburses 50%, then the FSA will automatically reimburse the remaining amount, generally the remaining 50%. After HRA and FSA reimbursement, the member is responsible to pay 100% of the amount due to the provider. FSA reimbursements will never exceed the available balance elected for the plan year. This slide only pertains to FSA participants who are not Blue Cross Blue Shield members. If an FSA participant has eligible medical or daycare expenses, they need to manually submit claims for reimbursement. To submit a claim, log into your account at www.selectaccount.com. Disability insurance is a company-paid benefit. The purpose of disability insurance is to compensate a member a portion of their income when illness or injury prevent them from working. Eligible employees are automatically enrolled in disability insurance when they become eligible with no option to waive. Waiting periods apply to short-term disability and long-term disability prior to receiving disability compensation. Members should notify their supervisors as soon as possible if they foresee the need to be out for an extended period of time. Medical certification is required to support the request prior to the benefit being approved and paid. This is all the information I will provide for now. If and when a member needs disability benefits, HR will initiate communication with the member to provide further instructions to apply for the benefit. Life insurance is also a company-paid benefit. Eligible members are automatically enrolled when they become eligible. The benefit pays 1 times the member's annual salary. There will be an opportunity for members to designate a beneficiary during the election process. PHS offers employees the opportunity to participate in the 401k retirement savings plan with Empower Financial. After a 90-day waiting period, employees can contribute through payroll deductions. A 401k is a retirement savings plan sponsored by an employer. It lets employees save and invest a portion of their paychecks before taxes are taken out. Taxes aren't paid until the money is withdrawn from the account. Participants have 100% control of their account, including how much money is invested and into which investments. Full and part-time employees may participate in the 401k plan after 90 days of service, as long as they have reached 21 years of age. PHS offers company match on 401k contributions for employees who have completed 1 year of service and 1,000 hours of employment, 25 cents per dollar up to 6% of compensation. The following example shows an employee making $30,000 a year, making a 6% contribution of $1,800. The company will match $450. Total contribution to the plan is $2,250. If you're not sure how much you should save, use this simple rule of thumb many financial advisors use. Here's an example of what a $75 contribution per paycheck would look like over 10, 20, and 30 years.
Determine your investment style by taking the quiz in the enrollment guide. There are a diverse mixture of investment options to choose from. Participants may select investments individually or use the default option, the target date funds, which are based on age. These funds are selected carefully and become more conservative as the participant ages. The custom model option is a group of investments carefully selected based on investment style, conservative, moderate, or aggressive. Participants can change their contribution amount and investments anytime by logging into their account. Investment, performance, and fee disclosures are mailed to you, or you can view them by accessing your online account.
The 401k plan is subject to a vesting schedule. meaning you must work for PHS for a specific amount of time before gaining access to PHS matched contributions to your account. You must work for PHS for 6 years to be 100% vested in company matched contributions to your account. Participants are always 100% vested in salary deferrals and rollover contributions. Rollovers are allowed from a former employer's 401A, 401K, 403B, or governmental 457B plan, or from an IRA. Loans are allowed from your account one at a time per rolling 12-month period. Take these as a last resort. The minimum amount is $1,000, maximum is lesser of 50% or $50,000 of your total vested account balance. Fee for loans is $75 origination fee with an ongoing annual $50 fee deducted quarterly at $12.50. The customer service unit at KeyTalk can help you to order a new PIN or personalize your PIN, review your account balance, investment options and allocations, as well as past transactions, transfer money between funds, change future contribution allocations, and obtain daily unit share values. Please review the enrollment guide and the summary plan description to gain more knowledge about the plan and your options as a participant. Employees will soon receive a welcome letter that will contain a PIN number to gain access to your account. On-site education on various topics will be conducted throughout the year. By now you know everything you need to know about our benefits and will remember everything in this presentation, right? No, I'm just kidding. We're all human and may need to review certain things from time to time. That's why we've made benefit information easy to access from anywhere when the time comes.
Benefit resources are located on UltiPro's homepage. For example, Benefit Guide contains detailed benefit information not included in this presentation, such as eligibility and qualifying life events. It also contains summary of benefits, websites, and step-by-step instructions for making your benefit elections. It also includes insurance rates, exchange notice, COBRA information, and more for your reference. For convenience purposes, benefits are also listed in sections. Click here for more benefit information to access more than the screenshot captures: provider name, group number, websites, member service phone numbers, summary of benefits, and more. Although most information is available by self-service, please don't hesitate to contact Human Resources with questions.
One more thing to mention, benefit premiums will not be deducted on the third pay period of any month with the exception of 401k or IRS mandated and legally required deductions. Let's move on to enrollment and election information. Employees must elect benefits within 30 days of hire. If elections are not complete, benefits will be assumed waived. Elected benefits will be effective the first of the month following date of hire. Important information to have handy prior to making benefit elections. Dependent information. Have your dependent name, social security number, and date of birth. Okay, so now you know what benefits you want to elect. Now you must make your elections online. Once logged into UltiPro, hover over Myself, then click Life Events. In the drop-down menu, select Life Event-Hire. Next, add your contacts. Designate each contact as a beneficiary, dependent, and/or emergency contact. Dependents, such as spouse or children, must be designated as a dependent if you intend to enroll them in health and/or dental insurance. Click Next to begin electing benefits. Most of the pages going forward will look similar to this one. Each page has a decline box at the top. Check this box if you want to decline the benefit. If you want to elect the benefit, click the radio button next to the benefit name, select the option, and check the box or boxes next to each dependent's name if you want to enroll them in that benefit. Eventually, you will come to the Confirm Your Changes page. Review your elections carefully. If you waive a benefit, the next time you will be able to elect it is at open enrollment or if you experience a qualifying life event such as birth, marriage, divorce, etc. If you notice an error, click the back button and make the correction. Otherwise, if everything looks good, click Submit at the top of the page. Once you've submitted your election, the benefit administrator will be notified and will begin enrolling you and your dependents soon after. Then you will receive a confirmation email with more information pertaining to health and dental ID cards.
This concludes the benefit training session. I'd like to thank you for taking the time to learn about the benefits PHS has to offer. If you have any questions, please do not hesitate to contact Human Resources and they would be happy to assist you. Enjoy your day!